First, let's talk about the adult chain of survival. There are 5 links in the chain. It starts with immediate recognition of cardiac arrest and activation of the emergency response system. Then it moves to early cardiopulmonary resuscitation, or CPR, with an emphasis on chest compressions. After that, rapid defibrillation is used. The next link in the chain is effective advanced life support that leads finally to integrated post-cardiac arrest care.
There are slight differences in these links if you're inside the hospital. The first link is surveillance and prevention of cardiac arrest with patient monitoring and assessment by the medical emergency team or rapid response team when a patient's condition is starting to deteriorate. The next link is early activation of the code team, followed by early CPR, early defibrillation, and post-cardiac arrest care. Post-cardiac arrest care may be provided in the cath lab and ICU. And this chain is really a useful metaphor to understand the connection and flow between the stages of emergency cardiovascular care. We just witnessed the chain of survival in action with the victim seamlessly treated. So now, let's go back and review the links in the chain of survival as they happen.
It's a normal day at the airport. We see the man's wife notice that he's not looking well. After he collapses, she immediately calls for help. A security guard rushes over to help. The guard gets no response or sign of breathing, so he directs a coworker to activate the emergency response system. The chain of survival begins right here, with the guard's immediate recognition of possible cardiac arrest and activation of the emergency response system.
A rescuer must recognize that the victim is in cardiac arrest based on unresponsiveness and lack of normal breathing. After recognition, the rescuer should ensure that the emergency response system has been activated and begin high-quality CPR. Effective bystander CPR provided immediately after cardiac arrest can double or triple a victim's chance of survival. Bystanders who are not trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult suddenly collapse, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers may provide further instructions and guide the bystander until trained help arrives. Some healthcare providers might find it necessary to provide compression-only CPR until a barrier device is available.
The guard immediately begins chest compressions without delay.
The second guard returns with the AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight, portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal. Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the victim loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing layperson and healthcare providers to attempt defibrillation safely. As the EMS providers arrive and take over care, they extend the chain to give the victim the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment to the victim. Once the return of spontaneous circulation, or ROSC, is achieved, the victim is transported to receive post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and on interventions that can improve long-term survival. These 5 links of the chain, immediate recognition of cardiac arrest and activation of the emergency response system, early CPR, rapid defibrillation, effective advanced life support, and integrated post-cardiac arrest care, show the most important actions needed to treat cardiac arrest. Basic life support is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for victims of all ages and practice delivery of these skills both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review the rescue again, pointing out the steps of basic life support as they happen.
You can see the guard scan the scene to assess safety in the terminal. even alerting another officer on his radio. First, he tries to get the victim to respond. Then, he checks the man for breathing by watching for chest rise and fall. He sees no sign of breathing.
Although the guard detects no breathing here, abnormal breaths are common in the first minutes of cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR.
As a lay rescuer, the guard does not check a pulse. Lay rescuers should not check a pulse and should assume that cardiac arrest is present if an adult suddenly collapses or an unresponsive victim is not breathing normally.
We see the guard start CPR by removing the victim's shirt and giving chest compressions. You can see that he places the heel of one hand on the center of the chest, just over the lower half of the breastbone. Then, he places the heel of his other hand on top of the first, and he keeps his shoulders right over his hands for leverage, with his elbows straight.
The critical characteristics of adult high-quality CPR are to push hard and fast at a compression rate of 100 to 120 per minute and a depth of at least 2 inches or 5 centimeters. Allow complete chest recoil after each compression and minimize interruptions in compressions to less than 10 seconds. There is some evidence that compressions that are too deep, more than 2.4 inches or 6 centimeters, can increase injuries from CPR. However, most providers do not perform compressions deep enough. You should focus on making sure your compressions are at least 2 inches or 5 centimeters deep. We recommend the use of feedback devices to ensure that your compressions are the correct depth. We'll talk about feedback devices later.
And as you can see, giving compressions requires intense effort. You'll discover this in a few minutes when we practice chest compressions. After the second guard returns with the AED and kit, she first turns on the AED. She then removes the adhesive backing and attaches the pads according to the diagram.
And the compressions are given throughout the process to keep blood flowing to the victim's heart and brain. Once the AED is powered on, it will give audible prompts on what actions to take.
Right here, the AED prompts responders to stop compressions while it analyzes the victim's heart rhythm. It takes just a moment for the AED to advise that a shock is needed. The second guard makes sure nobody is touching the victim so that the electrical current from the AED doesn't transfer to someone else. And then she delivers the shock.
Once the shock is delivered, most AEDs will give a prompt to resume compressions. But if it doesn't, compressions should resume immediately.
The guard initially provided compressions without ventilations because he did not have immediate access to a barrier device such as a pocket mask. Once the AED that included a pocket mask arrived, the guard was able to provide compressions and ventilations while the second rescuer used the AED.
The EMS team has arrived to take over. They use good team dynamics by asking the guard to summarize the history of events and care provided.
The EMS team assesses the victim and confirms that he is still in cardiac arrest, so they resume CPR. Now, ventilations are provided using a bag mask device.
The EMS team attaches their manual defibrillator to the victim. The device used by this team can be set to manual or AED mode. Use of the defibrillator in the manual mode requires advanced training to operate that we won't be covering in this course. In this scenario, the defibrillator is set to AED mode.
The AED advises that no shock is required, and the victim begins to move and breathe. The EMS team identifies an organized rhythm and a pulse.
It's worth mentioning that there are many ways that this scenario could have been different. This scenario shows how an integrated system of care helped to achieve a positive outcome, from the bystander recognizing a problem and getting help, to the lay responder initiating care, to the EMS team arriving, stabilizing, and transporting the victim to the hospital for post-cardiac arrest care.
You never know what situation you'll face or what resources will be accessible. But our goal is that with today's training, you'll have the knowledge and a framework to provide high-quality, life-saving CPR, regardless of the conditions and circumstances.